You probably put a lot of miles on your knees, and maybe there's been some bumps and bruises along the way, and maybe you have some osteoarthritis of your knees. I'm a chiropractor. My name is Adam Fields, and I have a lot of tools available to me. This one is the absolute best for osteoarthritis of the knees. Let me tell you why. Let's first talk about osteoarthritis. Number one, there's cartilage degeneration. The degeneration, there's two types of cartilage in your knee. One is the articular cartilage, and the other is the meniscus. The articular cartilage is here, and see that little red spot? That's when it starts to degenerate a bit. And so that can happen. The mechanics are off. Maybe you got a bike that doesn't fit right, and you're doing a long ride, or maybe soccer players, pickleball, all kinds of things can cause the knees to have attrition and then degeneration. So the first one is cartilage degeneration. The next thing that can happen, there's three hallmarks that you can see on an MRI for knee arthritis, and that one is bone spurs, right? The bones get jostled and they send out electrical charges when they get tweaked, and they draw in calcium and they start to get these bone spurs, which makes them tight. And you know how those knees where you're sitting for a long period of time and then you get up and ooh, that knee is stiff. Well, that can be some of this degeneration happening. So the bone spurs are the next one. And then you have what's called subchondral sclerosis. Subchondral sclerosis is just underneath the cartilage. You have this bone and it starts to get sclerosed or hardened, and then it undulates. It's a part of the osteoarthritis situation. And so that's the hallmark of all arthritis, but we're specifically talking about the knee.
I have had 4 orthoscopic surgeries on my knee that hasn't worked for the pain. Couldn't even really walk very well for a block and a half. I'd have to turn around, go back home and rest. Did this for quite a few years without realizing there was anything I could do for it. The doctor said I had arthritis, but really didn't do anything for me.
How can we help? How can the Piezowave help? Well, actually, this sends in focused shockwaves. Focused shockwaves are where we can delineate exactly where we want the wave to go. There's something else called radial shockwave that it's a different waveform and it blasts out like this. We tried it, we ended up getting bruised and scabbed, and it really was not a good machine for knees especially. And so we have the focus where we can focus it right into the joint, right onto the patellar tendon, right onto the cartilage that needs regenerated. And especially when we get an MRI, we can see exactly. If we don't have an MRI, you're actually gonna feel it. Your body will let you know and give you feedback when we're on the right spot. It's quite amazing. So the first thing is angiogenesis. It brings blood into the area, and without blood, you can't really get healing.
I felt like it was working and hitting the spot that needed to be treated.
There's some great studies on it. In fact, here's one: extracorporeal shockwave therapy minimizes ischemic tissue necrosis and promotes tissue revascularization by stimulating angiogenesis. It's been seen in skin grafting, tendons, muscles, the spine, even ligaments, the heart, the brain. We've seen revascularization from this technology. The Piezowave is by far the best. Low energy focused shock waves promote angiogenesis, and it stimulates tissue healing. Actual healing of the tissue with histological changes.
I heard about shockwave therapy, and I tried that. And after quite a number of sessions, I really started feeling pretty good. And a few more sessions, I can actually walk pretty well. Even to this day, my knees are really doing well. I haven't had any problems whatsoever with walking. I do it 10 to 12 minutes a day, 15 minutes a day.
Extracorporeal shockwave treatment in knee osteoarthritis. Therapeutic effects and possible mechanism. ESWT is found to have modifying effects on cartilage and subchondral bone, alterations in osteoarthritis progression, as well as the clinical complaints of patients including chronic pain and limited joint activities. We're talking about literally going in and lubricating those knees, cranking back time to an earlier time when they felt better, they moved better, and they had less pain. Extracorporeal shockwave treatment in knee osteoarthritis, therapeutic effects, and possible mechanism. Here they say overall ESWT could reverse the path pathology of osteoarthritis progression to some extent. I don't know what gets you excited, but this gets me excited. I love helping people. I will go to the ends of the world and buy the best equipment there is to help people. It's like throwing a touchdown pass to win the Super Bowl for me. We talked about bone spur reduction, and here's a study that shows bone spur reduction. Bone spur reduction, extracorporeal shockwave therapy shows regression of osteoarthritis of the knee in rats. Application of ESWT to the subchondral bone of the medial tibial condyle showed regression of osteoarthritis in rats. We're talking about reversal. We're talking about, again, cranking back time. How about just pain reduction? We all want pain. So what? There's histological changes. Am I going to have less pain? The effect of extracorporeal shockwave therapy on the treatment of moderate to severe knee arthritis. That's a big deal. Severe is more on this level where we have the bone spurs and we have the less cartilage and we have all kinds of things happening there. It's like an old dilapidated house in a way. So this study went big. They said ESWT, they brought their visual analog scales down, they felt better, and they say ESWT could protect the damaged cartilage and promote its recovery when it was used to treat rat knee osteoarthritis. Another study, it just keeps coming. Extracorporeal shockwave therapy for the treatment of knee osteoarthritis, a meta-analysis. Using ESWT to treat knee osteoarthritis may reduce pain and improve functional outcomes. That means more time on the pickleball court. That means more time hiking and less time complaining.
Yeah, it's been about 8 months since I've seen you guys, and my knee is still doing very well. No pain whatsoever while walking.
Cool.
It's been excellent. Piezowave changed my life dramatically.
Okay, we're going to keep going with studies, but this is just hearing the same thing over and over again, but success, 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 success. The efficacy and safety of extracorporeal shockwave therapy in knee osteoarthritis, ESWT was efficacious and safe for reducing pain and improving knee function in patients with knee osteoarthritis. Okay, one more. This one, there was a comparison of ESWT versus mesenchymal stem cell injections in rats' knees. So stem cell injections are hot. A lot of people are doing them. And what they found is they found the ESWT group and the stem cell group both did great. Okay, which is wonderful because the extracorporeal shockwave therapy, the Piezowave, is a lot cheaper and easier. There's no chance of infection. I like it better. I love going toe-to-toe with stem cells. However, when they did both together, and some of my patients will go get those injections, like a PRP injection or a stem cell injection, and then get the Piezowave, they found even better results with chondrogenesis, which is cartilage regeneration, and synovitis, which is a inflammation of the synovial lining. So really the combination is nice, but this alone is amazing. So if you want more motion in your life, less pain, if you want to be running, jumping, and skipping, I got to introduce you to the Piezowave.